this concept of getting research into practice, what we currently call knowledge mobilization, that seems to be the term that's used at the moment. Essentially, there's two ways of getting research into practice. The traditional way is to say, over here we have academics, people producing knowledge. Over here we have practitioners, people who are potential recipients and users of that knowledge. And what we have to do is transfer that knowledge from one side to the other. So that's the knowledge transfer model. It's based on a number of assumptions that essentially say that knowledge is something that you can package, something concrete that you can move. It's based on a belief that the decisions that you're trying to influence are one-off decisions, fairly straightforward, rational decisions. So that's a knowledge transfer model. It's a dominant model in the healthcare sector, and it's a model that works well when the knowledge that you're producing is pretty certain. So things like clinical knowledge, for example, it works quite well. The problem in health service research is a lot of knowledge that we produce is less certain. It's more ambiguous, it's more open to interpretation. And in that kind of situation, transferring knowledge from A to B doesn't seem to work very well. So instead, the assumptions are that knowledge is something that grows, something that develops through interaction between researchers and non-researchers. And the decisions that you're trying to influence are essentially social, interactive, participatory decisions. So what you want to do is to co-create knowledge together. And that's the essence of embedded research.
Particularly picking up this question about how to pull out the knowledge and learning through embedded work and leading to publishing, but in other ways as well.
So I'll let Cecilia speak afterwards about enabled publishing. But I think in terms of the pulling out knowledge, just the fact that the researchers are embedded means that all the time people are learning. It's not waiting till an end point. And that's really, really important, I think, when you're trying to deal with real life operational issues. And I think coming back to something Cecilia said earlier about the skill of the researcher to stay slightly removed so you don't get involved in the emotion that goes with that. But for me, what we observed was having the researchers there, constantly challenging, asking questions, being that critical friend meant there was learning happening all the time. And for me, learning is actually nearly more important than knowledge, because other knowledge will just sit there. Learning is what's actually going to make things happen. And I guess just, we talked about the projects as such, but we did also have the team ran some evaluations and study days, which health service evaluation, which teams found really useful because it was all about trying to get more and more people interested in research and interested in the outputs and looking for the evidence. And I can think of one example where someone contacted me asking for some advice on a health economics component of something they were doing, and the team just went and had a couple of conversations with them, and they were just blown away by the fact how it changed their thinking. And these are, how do we measure the impact of these things, I think is for me a really valid question. And then how do you, because publishing, we always think about publishing an end result or a stage. Actually, there's the incidental learning and impact that we perhaps need to think about how to capture.
Thank you very much. I'll just say we have 7 minutes left, so this is your opportunity to chuck in any last minute questions, comments, observations, if you're wanting to do so. And I feel we could get into quite a long philosophical debate about whether knowledge, if it's not learned from, is even knowledge in the first place. But with 7 minutes to go, probably we should leave that one.
About publishing.
So do you want to pick up points particularly about publishing?
Yeah, can I? Yes, but also in terms of knowledge, I just think that there's a really interesting feature of embedded research around knowledge and how that's shared and when, and I just think it's a model that allows you to share information, let's say, at different levels, because it could be that you are part of a team meeting and they're debating a particular issue and you're aware of research evidence related to that, and you might during that meeting share that information or signpost to where that information can be found, and that in itself is useful for a team. Without having to go into an entire research study that's 2 years long to co-produce them. So there's embedded researchers, because of their presence in the organization, they're constantly working at these multiple levels. And many times the difficult thing for us is to capture that impact, or like Reid was saying, I meet someone in the corridor and they have a quick question about how to research design, and I can have a chat with them, and then that could help them sort out how they're going to evaluate their service. So it's those little things, the more informal, I guess, ways of sharing that make it such a useful model.
So I'm really looking forward to a deeper understanding of this process of negotiation of knowledge. So the relationship between scientific knowledge, between experience, between intuition, between authority, between pragmatism, they're all ways of knowing that we all use as human beings all the time. I think we've tended to have seen them as kind of parallel ways of knowing. I'm really looking forward to understanding how they fit together in order to make a difference for patients. That's what we're here for.
For some reason, I think negotiation of knowledge would make a great crime book. Negotiation of knowledge.
Could be.